So we are in the middle of football season. High school sports, they're going to be in full swing from now until basically the end of May. And the one thing that we see, and it's a big concern, is concussions. Joining us now is CHRISTUS Trinity Francis to talk about some of the things that you guys are doing to help make it safer for students. So concussions, how big of a concern are they?
So concussions are a growing problem, and we see them in sports, we see them in motor vehicular accidents, we see them with older folks falling down, and in our war veterans having problems with blast injuries. So the reason we are talking about it today is this week on Friday is National Concussion Awareness Day. And that's a forum where we try to get more media presence so that we can bring awareness towards this growing problem.
Toward this growing problem. And what kind of, I guess, things are there to look for after a player does get injured? What is the concussion protocol like?
So concussions are sometimes hard to spot. You always have some who are very obviously hurt and get medical attention very quickly. But we also have more of a silent injury kind of pattern where the symptoms show up a little bit later or symptoms are confusing. So the first thing we would want people to do is, if they're hurt or if they're thinking they're hurt, is to get some attention from the sidelines. Then get an evaluation on the sideline, and if the trainer or the athlete is deemed to be, trainer deems that the athlete is concussed, then go ahead and get some medical attention. When you get medical attention, what we do is we specialize in sports concussion management. So we bring the same level of testing that is done at the professional sports NFL level to East Texas. So we do neurocognitive testing, test for memory, reaction time, balance, things like that. And then we assist in the rehab process so that we can return the athlete safely to school and to sports.
And what is that rehab process like for a concussion?
So the rehab process, I think the best way to explain it is that the brain is hurt and the person is having these really troubling symptoms like headaches, nausea, vomiting, sensitivity to light, having problems with memory, difficulty remembering things, balance, things like that. So it's in some ways a silent injury because the athlete looks fine, and most of these are very heavy set. Our East Texas football.
People that don't want to admit the fact that they are hurt,
yes,
is what it is, and
so
that's dangerous.
That's dangerous, and that's the challenging part, because a lot of times the symptoms are not very forthcoming. The athlete is not very forthcoming with the symptoms. So when we use neurocognitive testing, it allows us to go ahead and look at, it's like an EKG of the brain, allows us to see how the brain is functioning, and we can use that information to safely put the patient or the athlete back in play rather than just letting him go once the symptoms are resolved. Common misconception is that when symptoms resolve, patient is better, and that is not true.
So for parents, what do they need to know about their athlete being on the field after they've gotten hurt? What do parents need to know?
First thing I would tell parents is that if you are in doubt, always play it safe, because the brain is the only one organ that doesn't have the capability to regenerate new cells, things like that, so we don't want that. If they are worried, bring the patient to the medical attention as quickly as possible, preferably to somebody who specializes in sports concussion, can do all these advanced testing, and then use the rehabilitation process to not just return to sport, but also return to school safely, because a lot of these kids suffer in school where they are falling behind in work.
Their grades start to suffer. Well, thank you so much. I really appreciate it.
Thank you so much for having me.
Pay attention. It's extremely important. Coming